Welcome back. Here with us on Urban Debate, I'm Heena Gambhir. Has COVID-19 entered endemic stage in India? We're asking this question because yesterday the Health Ministry wrote to all states and union territories asking them to review, amend or end additional COVID-19 restrictions as the pandemic in the country is showing a sustained declining trend. Haryana has already lifted all COVID curbs in the state today. Now, countries like Sweden, Norway and Denmark have lifted almost all COVID restrictions as well. In India, the third wave that was triggered by Omicron has been receding since January 21, when India saw 3,47,254 cases coming in a single day. 4 weeks later, on 16th of February, India has reported 30,757 cases in just 24 hours. So there has been a significant reduction in our daily COVID count. In fact, the daily COVID count has been less than 1 lakh for 11 consecutive days. Now, because of this, viewers, many public health experts have suggested that pandemic is showing signs of entering an endemic stage. In a pandemic, a virus hits a larger geographical area and triggers wave of illness. In an endemic stage, the disease occurs regularly in some sort of established pattern. So let's try and understand from our guests the present state of COVID-19 in India, and can we ever expect a zero COVID scenario? Is life returning to normal? Joining us on the broadcast this evening are my guests. We have Professor K. Srinath Reddy, President, Public Health Foundation of India. We're also joined by Dr. Hemant Thacker, physician and cardiometabolic specialist, Breach Candy, Jaslok Bhatia and Reliance Hospitals in Mumbai. Good evening to both of you, gentlemen. Thank you very much for joining us here on Urban Debate on Mirror Now. Professor Reddy, I want to begin the discussion with you. Firstly, how will you describe the current stage of COVID pandemic in India? What should we call it?
Well, as you have rightly said, the case counts are falling. The death counts have also fallen after a period of interval which is expected between cases and deaths. And we are not seeing the hospitals being crowded. So certainly the epidemic is entering a quiescent phase. And therefore, we may be moving towards endemicity, but endemicity is not something that happens in a limited geography of the world. When there is a pandemic, we have to watch the pattern everywhere and then keep a watch on whether new mutants are arising or not. But at the moment, all the signs are favoring a movement towards a quiescent phase. And I would say we are on the road to endemicity.
So in simple terms, would it mean that our life is going to return to normalcy soon?
Well, I would say that most of the activities should return to normal, but we cannot completely abandon caution and say we are going back to 2019, because there are still parts of the world where the virus is still quite active. We have spoken of Europe, for example, as opening up fully, but closer home in Hong Kong, the hospitals are getting flooded with cases. So we cannot really say that everywhere in the world, the virus has receded. And we cannot completely rule out the possibility of new mutations emerging. So we have to keep a watch on that at least for a few more months, and then study the trends both within India and abroad before we completely go back on all the restrictions that we have imposed. Like, for example, masks. Now, movement can be much more free, and certainly schools and colleges should function, and most of the other normal activities should resume. But one of the precautionary elements against any variant is to prevent it from entering the body. You have to wear a mask in public places and in indoor places, workplaces. And I think that is a precaution that we must observe for a few months more till we are certain that no new variants are emerging to throw an unpleasant surprise at us from any part of the world.
So we'll discuss that in detail in just a bit. Let me also take the opening comments from Dr. Hemant. Sir, how will you describe the present state of the pandemic? Because we're getting mixed sort of reactions here. Some believe that the endemic stage is what we are witnessing right now. Professor Reddy believes that, we are moving towards endemicity.
So, there is no watertight compartment between pandemic and endemic. It's a phase. You drift from the epidemic and the pandemic stage, where you come into an endemic stage over a period of time. As you rightly said, that so many thousands and lakhs of cases 4 weeks ago is only 30,000 cases now, for a variety of reasons. Especially in our country, we have inoculated well, and most importantly, we infected, so many people have been infected, that the immunity is determined by injectable and by infected sources. So the virus now is underplayed. The virus has now become a weaker, lesser virulent virus. Now, as we are seeing in the 3 or 4 hospitals that I treat patients, we have hardly single-digit patients left. In Breach Candy, Bhatia, Jaslok, there are less than 10 patients or less than 7 patients. Because the people who are now getting infected, or even who were getting infected in the last 3 weeks, were all mild. They were staying at home. And we had predicted this in the first week of January, probably on your panel, when it's on your channel, where you asked us, are we really in the surge? Are we really in a deep crisis? When we said Mumbai has peaked first, so Mumbai will drop first. So we are at a stage in Mumbai when we are probably well into the first phase of the endemic area. But what Dr. Reddy says is right. Endemicity is not regionalized. It should be all over. A lot of people in Europe got infected, so they have taken it for granted that they are endemic. At the Far East level, I'm not sure about what kind of variants they have, because there is still a lot of information being filtered, especially at the Chinese level. But till at least more than 50% of the population gets infected, you will not get this endemic phase. And you should not think about COVID is zero, your opening question. COVID will not be zero, and that's what endemic is. With all the influenza injections, do you say influenza doesn't exist? No. You will have to learn to live with COVID. It'll be like in office. Why she hasn't come to work? Oh, she has COVID. On Monday she got it. She'll come on Thursday. The WHO, the ICMR, everybody is shortening the guidelines. So a time will come when COVID will be just another viral infection. Maybe we will have to take care as far as regular inoculation is concerned. But I also agree with Dr. Reddy. The mask is going to be a very effective weapon to allow the curtain to drop significantly on COVID. I would say for the next 2 months, we need to mask. We cannot be as carefree, or maybe careless is the wrong word, like the West, where they have dispensed with the masks. India is a large population. We live cheek by jowl. We rub shoulders literally in that sense. So we should mask. Social distancing, as and when you can, try and do it. Don't go to a mall or go into a theater pushing people. I think we are very much entering the endemic phase, and it's not going to be like a calendar which will say, okay, 28th February, new month has started, or from 1st March, pandemic over, endemic here. It's going to be a phase. We'll drift into it. And we are in the drifting process.
But drifting process is on, but you both have given us hope that, the way things are, COVID will probably become just like any other viral infection. And that's what we are moving towards. Now, I want to talk to both of you about the kind of restrictions that can be safely lifted from the from the states, from the country, COVID-related restrictions. Because Professor Reddy, Center has written to all the states asking them to remove extra curbs. Going by how countries in Europe specifically have started lifting restrictions, what do you think should be done? Is it time for India to fully lift all COVID-related restrictions and just have this mask mandate on and go ahead?
Well, basically, as far as the restrictions are concerned, most of them have already been lifted anyway. We have allowed international travel. There are no restrictions on domestic travel. As far as gatherings of crowds are concerned, for social events or otherwise, I think the numbers have been increased across various states, and offices are functioning, businesses are open. Colleges and schools, which were long shut, probably longer than they should have been shut, they're also now open. I think where we ought to exercise some restraint is, apart from the fact that we must ensure that people, at least as has been said for a couple of months more, we should certainly make sure that people are wearing masks in public places and workplaces and transport. But the other element is we must still resist the temptation of very large gatherings and crowds. That is something that is good for any illness, particularly any respiratory illness, even for flu. And since we are not 100% sure that we will not get a new variant entering our country or emerging in our country for the next couple of months, that's a reasonable precaution to take.
So I like this carrot and stick approach,
okay.
And so this carrot and stick approach is very good because people do not follow restrictions unless there is something looming large. And I agree with Dr. Reddy that we will probably have many new variants coming in. That these variants, will be milder is undoubted. But given that, we need to wear our masks. We need to avoid large crowds, cinema halls where you need not go, large malls where people just push and pull. If we take care, then any respiratory threat will be well exercised. Even weddings, just because the government has allowed 250 people and probably will allow more sooner, doesn't mean you have 500 or 1,000 people. I think the lessons from COVID would be to rationalize, to restrict, and to be practical. And that lesson, if we take it further, because no amount of other traction can be gained from COVID unless you learn from the mistakes and from the clues which led to this COVID surge. We have to be careful, we have to inoculate, and we cannot disregard the vaccination policy.
Now, Professor Reddy, as far as air travel is concerned, of course, it is happening. But international air travel, the normal international air travel still remains suspended. Only international air travel via bubble arrangement that India has with about 35 odd countries, that's currently going on. Last year, just before Omicron came into our lives, the government had given us a plan that, in the next few days, normal international air travel may resume. Do you think this is the right time to consider resuming normal international air travel too?
Well, frankly, travel restrictions never stopped the virus. They did not stop the virus from China. They did not stop the virus from other places as well. If you actually look at what happened in Italy in terms of sewage samples of November 2019 being later examined, the original ancestral SARS-CoV-2 virus was already present there. That means it had already started traveling out from wherever it came from Wuhan to other parts of the world. And similarly, it was found also in California fairly early on. in later evaluation of samples. So we know whether it is Omicron or whether it is the Delta, they've actually safely jumped the barriers that have been imposed. What we need to do is certainly to ensure that unnecessary travel is avoided, and we do keep a check on symptomatic travelers and get them tested if necessary. But having extensive travel restrictions is not really going to help.
Dr. Hemant, can unnecessary travel actually be avoided? Because we all remember what happened after the first and the second waves of COVID pandemic. There was revenge travel. People were locked inside their homes. The moment restrictions were lifted, they were all out holidaying, and those pictures were scary. So do you think some restrictions will be required?
No, I agree with Dr. Reddy that these restrictions would then become plastic and artificial. And you can, just like you cannot control people from going out and eating or going out and conglomerating, revenge travel is something which is already surfacing. And I won't be surprised if revenge travel will come back with a vengeance, because India is soon entering the summer vacation phase. However, this time the revenge travel is backed by a phase of probable endemicity, by a phase of good vaccination, where the world, especially the West, is down, numbers are less. So you cannot control people from traveling. And since the center itself has sent directive to the different states, I won't be surprised, not because I am a fan only of Air India, but the skies will open up and the government will slowly start allowing other countries to bring in their aircraft. The restrictions on vaccination certificates, probably symptomatic testing, they will need to contain potential infections. At the airport, there will be these booths and cabins, and the honesty of the passenger will be tested, that if you have any respiratory symptoms, you need to identify and test and then probably quarantine. But I'm not sure that we need to restrict international travel anymore. The bubble will burst and everything will and soon will open up.
Okay. So that's an important point you both have made as far as the international air travel is concerned. Professor Reddy, I also want to ask you, looking at the current stage of the virus, can we ever know whether the next variant is going to be milder? Is there any way to be prepared to deal with, the next variant or the next wave that it could trigger?
Well, there are several possibilities. The most likely probability is that it will continue to be a mild virus and may even evolve into a milder form further. More infectious, perhaps, possibly even a little more of immune escape ability, but certainly more capable of coexisting with us with less virulence. Because that is the nature of evolutionary biology. When it doesn't get enough number of human beings to infect because they're already immune, or they're masked or otherwise not permitting themselves to be infected, the virus will go milder even if it tries to become more infectious. On the other hand, there are some possibilities that it could actually turn more virulent or change its character if it actually mutates into a more virulent form by what's called an antigenic shift, where it combines with another virus in the body of an infected person, or even in an animal, because now we know that these viruses are capable of infecting animals. But those are low probability events. And as Dr. Thacker said, if we actually have more people immune, and less likely to fall ill and harbor the virus for a long time in their bodies, then the virus doesn't get an opportunity to replicate fast and mutate many more times. So if we actually protect ourselves initially now with masks, but also with vaccines, we are not likely to give the virus enough of a leeway to turn into a much more virulent form. If at all, it will turn into a less virulent form.
Okay. Mask is going to be our very, very important shield. That's the bottom line. Dr. Hemant, should we continue to be aggressive as far as testing is concerned, or do you think a change in strategy is needed there too with the case count coming down?
I agree. That's a very valid question. And I can see that there are already murmurs going around the official circles that you don't need to keep testing so much. In my hospitals itself, when a patient is to be admitted now, we do an antigen test and admit. We don't do RT-PCRs anymore. So this unnecessary testing of RT-PCR now, it appears unnecessary. And there will be some restrictions still for certain kinds of people. But in general, the testing will have to be toned down. Though the aura of the virus is less, we still have to remain vigilant, but we don't have to be aggressive on the testing. I would like to give this message on your channel that instead of getting frightened, that what if the next variant is going to be horrible? Let us say, even if. The frightened say, what if? The practical say, even if. We are clinicians. We have successfully faced the Deltas, the Omicrons, the first wave, the second wave. And I think now science has understood. So we'll have to now wait for another 100 years when we'll come back onto your channel and tell you when the next pandemic comes in. But even if anything happens now, we should and we are prepared.
That's an interesting point. Even if something happens, we are prepared. Professor Reddy, what is your view on the issue of testing? What will you recommend to the government, which is asking states to lift all COVID-related restrictions? In fact, during the third wave also, we saw several, advisories coming wherein there wasn't too much emphasis on getting everyone tested.
Well, actually, it doesn't really help very much to get everyone tested, irrespective of symptom status. Anyway, most people who are asymptomatic don't get tested. Some of the people who are symptomatic, they will have false negative tests. Therefore, we ought to really restrict testing to where it's necessary now, certainly for cases in hospitals and possibly even for a fraction of the people who are international travelers. The reason why a certain level of testing needs to continue is to be capable of detecting if new variants are emerging. So if you are actually testing a certain amount and isolating cases who are positive for viral presence, and a subsample of that goes in for genomic analysis, then you may be able to pick up whether there are new variants that are emerging within the country or entering from outside the country. Other than that, for that purpose, extensive testing at this point in time is not going to carry any major advantage.
Okay. Now, Professor Reddy, one more question before I go across to Dr. Hemant on the other issue. In the article that you've written today, you've also mentioned that apart from nasal or throat swabs of infected persons, sewage samples also provide means of identifying the nature of circulating variants. So once the case count comes down, if this method is followed, do you think we'll be able to identify if there are new variants or not? Is that what you were trying to say?
No, already different countries have already started doing sewage surveillance as a matter of routine now to try and find out whether the viruses are still circulating in large quantities and if new variants are also emerging, because they can be picked up even from the sewage surveillance. But if we can actually institutionalize sewage surveillance as a part of our municipal systems, then if we are likely to detect a new microbe or a new variant emerging earlier than presently, then that's fine. In fact, many countries now, whether in Italy or in other parts of Europe or in California, have now started institutionalizing this, and I believe the Indian Council of Medical Research is also planning to do that in several municipal locations. So I think this is one of the methods of our finding out how best we can do it. Apart from One Health surveillance, where we are also looking at different animals, both in the forestry as well as in veterinary populations. We also need to find out whether there's a spillover from one species to another species. All of these are going to be part of the new surveillance systems.
Okay. Now, last question for the two of you. Dr. Hemant first. Is it time now to open booster shots for everyone?
Well, you must give booster shots to everybody who received their first and second doses. So everyone who received first and second doses must get booster shots. And I'm also happy to see that the government is considering Corbevax for kids between 12 and 15. Because in the years to come, or probably months first and then years, vaccination will be the policy to go by. If you throw away your mask after 2 to 3 months, you will still need the vaccine protection till COVID completely goes behind us and we can say, okay, we are more or less COVID-free and we don't mind if the COVID virus is circulating, it's not going to touch us. So you must allow boosters to all people who received 1 and 2.
Okay. Professor Reddy, what about you?
Well, depending upon the availability of vaccines, I would entirely agree with Dr. Thacker. But in case there is a short supply of vaccines at any point in time, I would say all the people who are vulnerable, either because of high risk of severe disease if infected, or severity of infection because of repetitive exposure like health workers, they all must receive their boosters. I would say, given the Indian conditions, people even above 45 years of age, but below 60 years of age, many of them have comorbidities like hypertension, diabetes. They need to be protected as well with boosters if possible. But if you have adequate amount of vaccines available, particularly if the protein vaccines, subunit protein vaccines are available in plenty, we ought to vaccinate as many people as possible because immunity wanes. We know that immunity is waning after 2 doses also. So the better protection that we can give to people against severe disease, it's to our advantage.
All right, gentlemen, thank you very much for joining us here on Urban Debate this evening and giving us hope that it might not be a zero COVID kind of a scenario, but at least COVID will become like any other viral infection in the near future. That's where we are heading. Thank you very much, both of you, for joining us here on Urban Debate this evening. Heading into another very, very short break, but there's lots lined up for you on the other side as well. Stay with us.